Wanted to welcome you all for showing up today, and we've got a really exciting episode here on the Next Gen podcast. The person that we're going to be talking to today is Richard Brewer with Paragon Benefits, and I'm excited to bring Richard on because he's going to give you a nice high level overview of what a third party administrator or TPA does for your health plan. So, with no further ado, I'd like to introduce Richard Brewer with Paragon Benefits. Richard, how are you doing today?
I'm doing fantastic. Can't think of anything else I'd rather be doing than talking about TPAs.
No, I love that. Tell us a little bit about who Paragon Benefits is.
So Paragon Benefits is a third-party administrator. We are based in Columbus, Georgia. However, we work nationwide, and the role of a third-party administrator is to kind of be the center of attention when it comes to partially self-funded plans. We kind of pull all the pieces together and administer the claims and make sure everybody gets paid efficiently and effectively and on time. And I'm sure we're going to dive into more of the details on that here in just a minute.
No, absolutely. And Richard, really for a lot of people, I like to explain a self-funded health plan is four different parts. There's the stop loss, there's third-party administrator, there's the PBM, and then there's me, the advisor side of things.
Mm-hmm.
As one of the core concepts of a TPA, can you just real quickly go into what a TPA does for a health plan?
Yeah, so what a TPA does is act in the function that an insurance company does, but we're not an insurance company. So we do all of the blocking and tackling and like I said, pulling all the pieces together. We sort of act as the quarterback since we're coming up on football season. We coordinate everything and make sure the right play is called and make sure that everybody's doing what they're supposed to be doing when it comes to a health plan, all the moving parts that are involved. And you named a few already.
Yeah, no, absolutely. A lot of people think that a TPA just processes claims. Can you walk into how a TPA is really more than just a claims processor? And then also let's dive a little bit into on the actual claim side, breaking that down a little bit as well.
Yeah. So when you think of a health plan, as a member, you get an ID card and it has all the information on there when you go up to the provider's office or to the hospital and show your insurance card. Well, there are a lot of things that happen once someone gets a service at a provider, whether it be a doctor's office or a hospital or anywhere in between. And so our role is to act as the quarterback, putting all the pieces together to make sure that that provider gets paid, that the claim gets paid, that all of the pieces, whether it be the PBM, the network, or something other than a network, all of the parties that are involved are getting what they need to make sure that the member gets the service that they're wanting to get that particular day and the reason they're paying their insurance premium. And so when it comes to that claim getting adjudicated properly and according to the plan, the way it works, that's the biggest role of a TPA is to make sure all of those functions happen per the plan design.
No, absolutely. And one of the things when it comes to claims payments that's kind of a hot topic right now is the fraud, waste, and abuse. Can you walk into a little bit how a high quality TPA helps to eliminate those issues of fraud, waste, and abuse with inside your health plan?
Yeah, so there are a number of things that we look at. We have systems in place and procedures in place to ensure that when we receive a claim in, when we ingest that in, we're looking at it from a number of different angles. Number one, is this a provider that is part of the program as it's been designed? Number two, is this particular procedure or ICD-10 code, is it covered by the plan? And if so, we make sure that it gets paid according to that plan design. So sometimes we'll get a duplicate bill. We might get a bill 2 or 3 times for the exact same procedure on the exact same day for that member. And so we're looking to make sure that we're not getting any duplicate claims, that we're not getting a claim that might be involved with, say, a car accident that need to be covered by that auto insurance policy, things like that. So a lot of different pieces that are put into place to make sure that claim gets paid accurately, if at all. Sometimes we get claims that aren't covered or don't need to be covered, and so we send those claims back. So we're looking to make sure there's no fraud involved, that there isn't any abuse, any multiple billing, things like that, and then any waste. And so the waste piece can be addressed by the way the plan is designed. whether we be doing a network or say reference-based pricing or somewhere in between. If we have a direct contract in place, we want to make sure that that claim gets paid the way it's supposed to be paid, according to the way the plan was designed by you, the consultant, and the group.
No, absolutely. And I did a video a while back on an article I had read that it was like $1 in 3 that enter the U.S. healthcare system are potentially wasted. So it's really important to have that right third-party administrator on board with your health plan to help make sure that we're not, adding you to the statistics from a health plan perspective of wasted money. So, Richard, when people are wanting to evaluate their current third-party administrator, or whether they're looking at a new TPA to bring on board, what are some of the things that you would encourage groups to really be taking into consideration when they're doing that evaluation process?
Yeah, so I think it all comes back to what is the group's goals when it comes to accomplishing or getting their plan paid properly and getting it to work the way they want it to function. And that comes back to, so why are you looking at a TPA? Are you going to be looking at carrier-based plans? ASO is another term for that, administrative services only, an old term that's left over from eons ago. So what are the goals that are for that group? What are you trying to accomplish? And based on those goals, is this TPA going to help you accomplish those goals? Meaning, let's just use an example. So let's say you and your client say, you know what, we're in a fully insured plan, or maybe we're with a carrier-based plan, or we want to go to a independent third-party administrator to help us accomplish our goals of eliminating fraud, waste, and abuse, lowering costs, increasing care. Let's say that's what some of your goals that you want to accomplish. Then you need to be evaluating those TPAs. Can they help us actually do that? Or do they have systems and things in place at that TPA that might prevent us from being able to accomplish those goals? For example, maybe the TPA is getting paid by some of the vendors that you don't want to use, and they're actually asking you to use some of the vendors that are going to go against your goals. And so those are kind of the things you will evaluate on the front end to make sure you're aligning yourself with the proper claims payer to help you accomplish those goals. If that makes sense. A lot of detail behind all that, but that's 30,000 foot level of what you may want to be trying to accomplish with the TPA.
No, absolutely. And you had kind of touched on a point that I want to drive a little bit deeper on.
Sure.
You had talked about the fact that sometimes TPAs have preferred partners and they kind of want to silo clients into utilizing those specific partners. And a lot of times it's because there's some type of revenue stream that's coming into it. Another hot topic these days is being a fiduciary, a part of the Consolidated Appropriations Act of 2021 requires that health plan administrators or employers be a fiduciary of their health plan spend. So let's talk a little bit about how TPAs get paid and how somebody can properly evaluate to make sure that they're meeting their fiduciary standard as far as an administrator goes.
Great question. And this is a hot topic for me because as a former broker, Nick, I always felt like I needed to kind of stand in the gap and help protect my clients from being taken advantage of. And not to say that TPAs take advantage of the clients. Certainly some might, but not all do. So the way you want to approach this is, again, come back to your goal. What is it that you and your client are trying to accomplish? And you're right, the new laws are handing this down and making it ever more clear that the plan sponsors are the fiduciaries for the plan, meaning just like they might have done 12 years ago on their retirement plans, there are some teeth a little bit, we think, to the law that says, you know what, you, Mr. Plan Sponsor, Mrs. Plan Sponsor, are now going to be even more responsible to make sure that you're protecting the assets in this health plan for the members of this health plan. And so with that in mind, some of the questions you might want to ask is, Mr. and Mrs. TPA, how do you get paid? And I'll just mention the number one way TPA gets paid is for their administration services that they provide, paying claims, looking out for fraud, waste, and abuse, doing all the coordination between the different vendors, whether it be the PBM, the stop-loss carrier, the network if there is a network, and all the other pieces that might be a part of that program. For those services, a TPA gets paid a quote administration fee. Now, beyond that, depending on the TPA that you're talking to, they might be making money in other ways as well. They might be making money company with the PBM or the stop loss carrier or the medical management company or the network in various other ways. Not there's anything wrong with that. But you as the consultant and the plan sponsors need to be aware of that. And those are the kind of questions you want to ask. TPA, how do you get paid? Would you please disclose that to us? We want to make sure we understand that and that we're okay with it. Back in the day, when I was a broker, I would ask those questions. We didn't always get straight answers. And so what I didn't like, I didn't prefer when TPAs made money and we're competing with myself and the client, but I was okay with it if they at least knew about it up front and it was disclosed to me. What I really didn't like is when we found that out, me and the client down the road, once we were already working with this TPA, hey, they're making money in 6 or 7 different ways. We weren't aware of that. That's not good. The laws are there now to protect us all in that fashion, but you still need to ask those questions. You need to understand that and make sure you're okay with the different ways that the revenue streams are being made by the TPA.
No, absolutely. And I think each and every day we're going to get more and more clarity on the Consolidated Appropriations Act. But there is definitely no question about it that employers are the fiduciary of their health plan. And so it's something that you guys need to be taking into consideration. Now, Richard, I know that we have more than one human resources person that's listening to us today have this conversation. One of the priorities of human resources administrator or director, whatever level of that department, they want to make sure that the employees have a good experience. So how can you evaluate the customer service of a TPA? And what are some things from a customer service standpoint that can make a TPA stand out amongst the crowd?
Yeah, so great question. So just like you evaluate an insurance carrier or company and their customer service and how they take care of the members, you want to ask those same questions of a TPA because they're in a sense doing the same roles and functions as a big carrier might in a regular plan, a fully insured or self-funded plan with a carrier. And so some of those things are going to be, how are the claims paid? Are they paid efficiently and accurately and on time? What is the customer service experience like? Can we get our ID card when we're supposed to get them? When we call into the TPA to ask questions about our plan, do we get answers quickly and do we get accurate answers? All of the same questions you would ask an insurance company, you need to ask those questions to the TPA because in large part they're providing those same services. And those TPAs should be able to provide you some metrics on customer service, timeliness, accuracy, and so forth as well.
No, absolutely. As far as customer service, that's more than just our employees. That's also the providers in the facilities in your community that are providing us services. Those are our customers as well.
Right.
And so explain to me how somebody can kind of evaluate that part of a TPA. When we're talking about things like timely payments, timely claim processing, and how that impacts. Because the reason I bring this up is the last thing you want to do is have an administrator in place that is taking forever to make payments to these different parties, because that decreases their likelihood that they want to work with your health plan. Yep. So in return, that impacts your employees. So Richard, can you dig into that a little bit as far as the customer service of the actual vendors that we're purchasing care from?
Yeah, so from an evaluation standpoint, as you and your clients may be looking at a TPA to potentially work with, some of the best ways to get those answers is ask some of their current clients. Ask the TPA for some clients in the area where your client's going to be Nick, for example, and then ask, especially if you've got a consolidated area where a lot of your employees and their families live, and which providers and hospitals and things like that they might be using. Ask those providers, do you work with this particular TPA? What's your experience been like? Just no different than you would any other service that you purchase on a daily basis. If you were going to be buying a car from a dealership, you might ask some of their customers, you might ask some of the people that that have purchased there, some of the vendor partners they work with and so forth. So it's no different. Because if a TPA is offering great service, then you're going to hear those questions that you ask. Likewise, if they're not providing a good service, you're going to hear that as well. And again, the TPA should be able to provide you some metrics and some examples of that as well to help.
No,
process.
Absolutely. And Richard, one last question I have on the customer service side of things.
Yeah.
And this is a moment I'd like to kind of highlight Paragon a little bit. Uh, you guys have a really unique customer service model with your pods. Could you just explain that to us real quick? Because I think that's a really neat way that you guys have approached customer service to ensure that you're eliciting a high level. So,
Right.
walk into that for a second for me.
Yeah, so I'm glad you asked that. So I'll give you the quick history on that, how that came to be. So as I kind of alluded to earlier, I used to be a consultant. I used to sit in your seat and did that for about 15 years. More importantly, I've been a user of health insurance for a lot of years. I don't want to say how many years. Almost 40 plus years I've been using health insurance. And so as a user of health insurance and as a former consultant working with clients that use health insurance, um, we realized we were having some issues probably 10 years ago when I first joined Paragon. Our customer service was not where we wanted it to be. It wasn't horrible, or it wasn't as good as we wanted it to be. So we basically, as a management team, sat down and said, okay, let's get on the other side of the table. Let's pretend we're the member, we're the users getting the service of our TPA. And if we could erase the board, we could draw up there exactly what we want that service or that experience to look like. What would that look like? And so we did that. We went through that exercise. And so what we wanted were things that everybody else wants. We want when we call in to get answers, we want a quick answer. More importantly, we want an accurate answer. And number three, how do we avoid having to have our members call in the first place? How do we do things in such a way and provide a service in such a way that there's not a need or a necessity for them to have to call in a whole bunch? And so what we went away from is we went away from the traditional insurance company style or traditional corporate style environment of cubicles and departments and people having the opportunity to maybe hide behind that and say, well, that's not my department, let me transfer you over, or that's not my responsibility, or whatever the case may be. So what we decided to do differently is to form into teams, or as we call them, Paragon pods. And within that pod, you've got all the expertise you need to service a client. You've got a stop loss analyst, you've got a claims analyst, you've got a customer service person, you've got Cobra, you've got all of the different compliance pieces you need to answer any questions that might come up. And so for our clients, we give them the opportunity to actually develop a relationship with their team. So there's no more calling into a bank of customer service people where you might get a different person every time you call in, and unfortunately maybe a different answer every time you call in. We've eliminated that. So there's accountability, there's relationship building going on, and just as important, we think, is there's iron sharpening iron going on within our own team, within our own Paragon pod. So I might be the stop loss analyst. Nick, you might be the customer service person. And so we're sitting in a pod environment where there are no walls. We can all see each other and talk to each other. So I might get a call, you might get a call as customer service, and it might relate to stop loss. You can put that person on hold briefly and say, hey, Richard, remember we talked about that issue yesterday. What was the answer to that? Okay, great. And then you can get back on the phone and answer that question very quickly, very efficiently, very effectively. And also, you're learning from each other. So when you're out tomorrow, Nick, I might be able to field that question, even though I'm on the stop loss. I might be able to help answer that question. So we don't have to wait for Nick to get back into the office next week before that answer is given or provided to the member. So all of those things combine for a much, much better experience. We give power and control within that pod to make decisions. They don't have to always go seek management approval. We want that to happen so that these are the people that are closest to the issues. They understand them the best. We want those issues to be resolved quickly and effectively. And also we design it so that our pods only have a few clients. They might have 5 or 6 clients, but those clients are very similar in ilk. They're very similar. So they might all be in a certain geographical area, or maybe they're all municipality clients or something like that. So that if we have an issue, we realize that, okay, if it's happening for client A, it might be happening for client B, C, D, and E as well. So let's go ahead and proactively reach out and nip this in the bud now, as opposed to waiting for it being a problem and then fielding those questions and being on the reactive side of things. So you combine all that together, Nick, and I'm proud to say, as I'm going to knock on wood as I'm saying this, as chief sales officer at Paragon, I don't remember the last complaint call I got from a member, from a broker, or from a provider about our service. That's how good it is. So I think that's one of the things that separates us as a TPA.
No, and that's partly why I wanted you to dive into that a little bit.
Yeah,
Truly, when it comes to administering a health plan from a employer perspective, one of the things that we want most is happy employees, and so the right partners really go a long ways in helping to ensure that that satisfaction is there from a usage standpoint for your employees. So, Richard, pivoting a little bit, but along the same track, one of the benefits of working with a third party administrator is flexibility. A lot of times when we're talking about an administrative service organization or ASO, when we're talking about fully insured, a lot of times we only have an option of a few different plans,
right.
but each business and each business's employees are unique. So walk into some of the flexibility that a client could expect with an independent third-party administrator as far as designing a plan that actually meets the needs of them and their employees.
Yeah, that's a great question. This is something I talk about a lot with prospective clients and brokers. And this is also part of the evaluation process when you're interviewing TPAs to decide who you want to work with. You want to find out how flexible can we be? What options do they provide us? And I'll just tell you from Paragon's perspective, we feel like we're one of the last bastions of truly independent, fully flexible TPAs that are left anymore. Unfortunately, in our industry and in most industries, consolidation happens over time. Look at the auto industry, look at the telephone business. Over time, you consolidate down into the top three or four major players, and that's not as good for competition and for pricing. And so most of the TPAs over the last 10 to 15 years have been bought up by either carriers, private equity firms, and consolidating them together. And so there aren't too many truly independently owned TPAs left anymore. We happen to be one of those. And we also happen to only have one revenue stream. That's our admin fee. We do not make money on any of the other components of the plan. Some TPAs do. There's nothing wrong with that. We just choose not to do that. We think that allows us to be 100% flexible because we're agnostic. All the vendor partners are out there. We can work with anybody that you want to work with. So when you and your client are sitting down and scratching out what you want your plan to look like, the sky's the limit. You can choose whichever partner you want to work with. The only caveat is that if you bring us a new partner that we don't currently work with, there might be some setup time to get that connectivities taken care of. But other than that, we want the best plan for our clients. We want it to be bespoke and specifically designed for them. So in that vein, we really are fully flexible. And those are the kind of questions you can ask your TPA. Some TPAs say you've got to choose one of these 4 or 5 PBMs, or you need to choose one of these networks, or we prefer you work with our stop loss carriers, things like that. And that may work for your client, but in some cases it may not. You just need to ask those questions.
Absolutely. One of the things that I'm a big advocate for is purchasing healthcare differently, which means that we're leveraging a lot of different tools. One of my favorites is direct contracting. We're able to, as you know, purchase healthcare much more efficiently by having direct contracts in place and steering members to higher quality, lower cost care. How we've talked about how a TPA is really the quarterback of a plan, but I know from experience that not every TPA handles these situations as well as others. What are some of the things that we need to take into consideration when we're starting to get creative in that journey to purchase healthcare better?
Yeah, so I think you need to view your TPA partner once you've chosen your TPA as a partner, truly as a partner, and bring them into that discussion because there are things that go on behind the scenes in TPA that you and your client just wouldn't think of because you don't do it on a daily basis. Just like whoever your client might be, ABC Manufacturing Company, we have no idea what they do behind the scenes manufacturing their widgets, right? So bring your TPA partner into that discussion and say, hey, here's kind of what we're thinking about putting together. Are there any issues that might come up as a result of what we're trying to put together here that you can think of? I'll give you an example. I was just working on that today. About 2 hours earlier, I had a call with a client who's going to be joining us in a couple of months. And they're wanting to do something like you just described. They're wanting to do more direct contracting, reference-based pricing, but they're in a particular area of the country where there's a major hospital that is not very, very cooperative. So we're trying to figure out how do we work within the confines of those constraints, create a plan that works best for the client. and we're running into some difficulties, not overcomable, but some difficulties. We're also got a timing issue because they're wanting to make a transition in a couple months, and we need to bring in some new vendors and get those connectivity set up. So that's why I say bring your TPA partner into those conversations so they can let you know, okay, here are the things that will need to be done to accomplish your goals. Here's how much time it's going to take. You need to factor that into your decision process. Maybe we push it back a month, or maybe we don't do this vendor this year. We wait till next year. Things like that come into play.
Oh, 100%. And I tell people all the time that uh, the great part is that you don't have to be the expert. If you have independent parties that are working on your behalf, they're happy to come to the table and provide that guidance for you.
Correct.
A couple of last questions for you. One of the places that I see people get confused, or maybe it's just a knowledge gap, is that a lot of times your third party administrator can handle your HSA, your HRAs, FSAs, COBRA administration. Can you walk into some of the common services outside of just administering the health plan that a TPA can serve for a client?
Yeah, you just named quite a few of them. Cobra is a big one. HSA, HRA, any high deductible health care type plan, and those accounts that are associated with it. Flex accounts, all of those accounts. Again, that's where you want to have a conversation. That's actually on the front end when you're interviewing a TPA. Hey, Mr. or Mrs. TPA, what other services do you provide? Because the client might already be using a couple of different vendors for those other services, Cobra and HSA and things like that. There might be an opportunity to save some money and consolidate those services into one partner, which might be your TPA. Again, you just need to ask your TPA, what can you do? What other things can you do for us? And factor that into your decision process, not just from a cost standpoint, but from an ease of use standpoint as well.
Absolutely. And speaking of ease of use, I'll kind of let you take this one, Richard. What are the benefits when somebody is we have validation of claims when we're using HRAs or HSAs, any type of these savings accounts? There has to be a validation that it is a legitimate claim. How does having that in-house with your administrator make that ease of use a little bit better?
Well, it comes down to communication, probably more than anything else. If you've got multiple vendors handling the same claim, there are more steps in the process. Unfortunately, there's more ways that something can go awry or maybe get held up or go wrong. And so, again, you have to make that evaluation on the front end. Depending on the service you're looking at, does it what makes the most sense for us? And hear out both the vendors, hear out both sides, your current vendors, and maybe this new vendor, maybe this new TPA you're talking to find out, okay, what sounds like to us, being you, the consultant and the client, is going to work best for us in the plan design we're wanting to put together here. Not just from cost, but also coordination. So you have to factor both of those into the process, I think.
Absolutely. Richard, we're coming up on time here, so I've got a final question for you. I'm a big advocate of accountability. I like a customer or a client of mine, I like them to be able to have accountability metrics in place or ways that they can track the performance of the different partners that they're bringing in to administer their health plan. What are a few common ways or a few ideas you might be able to give on ways that you can track the performance of your third party administrator, or some things that you should be setting as an expectation that needs to be met?
Yeah, so we haven't touched on this yet, but reporting when you work with a TPA versus a carrier, typically your reporting is going to be much more robust with a TPA. Call it what you will. The way it works with the big carriers, it just doesn't work as well, or you maybe not get the reports you want or the level of detail you want with the carriers. With a TPA, if you're not getting much more detailed and robust reporting, then maybe you need to talk to some other TPAs. But that's one way to answer your question, to measure that. But then also TPAs should be able to offer you some metrics that maybe even put their fees in based on how they perform around those metrics. Those are some things you can ask in the interview process as well as for the fees we're going to be paying you to process our claims and everything else that's involved with this plan adjudication. How can you ensure that we're going to get accuracy and timeliness? What metrics can you show us that prove how well you are doing your job? And TPAs that are, if they're worth their salt, should be able to provide that data to you without any real big issues.
No, absolutely. And really, one of the kind of to wrap this conversation up before I let Richard go, the beauty of self-funding and using independent third-party administrators is that you unlock a lot of flexibility. It allows you to really create a plan that you and your employees actually love, makes it an asset for your business. But it's super important to have the right partners. And I would echo the fact that Paragon, their only source of revenue is a monthly admin fee. And there's two reasons I really like that model. One is that they grow with you. Rather than your stop loss premium going up every year and them getting a percentage of that, the more employees you add and the more success your business is seeing, the more success that they have. They're making more money along the way, which is really great. I love that transparency. But I think Richard also gave some really great ideas around what to look for in a TPA, and then also some great ideas on how to hold them accountable, because again, we want to make sure that these partners are delivering the value that is commensurate with the amount of money that we're paying them to help meet our fiduciary responsibilities. So with that being said, Richard, I really appreciate you coming on today and letting us have this conversation. You know that I'm passionate about having the right partners in place, and so hopefully this helps some people figure out how to get the right football team on their side to make sure that they're winning more games. So, Richard, again, thank you. I hope that you all have a great day, and we'll talk again soon.
Thanks, Nick. See you, everybody. Thank you.
Yep. Bye.